Hello and welcome to our presentation called Gaining Traction. My name is Anne Gottert. I'm from the Population Council. HIV and violence prevention programs are increasingly seeking to transform gender norms. Yet evidence is still lacking regarding whether it's possible to shift gender norms at the community level, as well as how such shifts happen and how they affect intimate partner violence. The intervention we're focusing on was called SEMA, or Working Together. The setting was rural Mpumalanga province in South Africa. This was a 3-year community mobilization intervention focused on reducing social barriers to engagement in HIV care, including gender norms and IPV. The intervention was implemented by Sanke Gender Justice. The current study was nested within a cluster randomized controlled trial covering 15 villages. Data sources for the current study include post cross-sectional household surveys as well as qualitative research. We found that there was a large increase in endorsement of equitable gender norms between baseline and endline, but this happened in both intervention and control communities. Between these two surveys, men experienced the equivalent of a 17% change and women a 13% change in gender norm score. We found that shifts were most likely influenced by a rapid increase in access to media, especially via satellite TV and smartphones. Participants described increased exposure to serial dramas modeling equitable relationships and negatively portraying violence. Turning to changes in IPV, for younger men, ages 18 to 29, there was a decrease in IPV in both intervention and control villages, similar to what happened with gender norms. For younger women, there was a significant intervention effect. Qualitative research suggested that reduced IPV in intervention villages was due to couples learning to communicate more equitably and constructively through SEMA. SEMA may also have helped participants connect what they saw on TV to their own lives. In summary, there was a population-level shift towards greater endorsement of equitable gender norms that was potentially linked with escalation in media access. There was also an intervention effect on reported IPV among younger women. Our findings suggest that gender norms can shift substantially at the community level and in a relatively short period of time. It is important to pay attention to broad social changes underway and to consider how these changes can be leveraged to improve health behaviors. It is also important to emphasize critical reflection and skill building around equitable couple communication within HIV and IPV prevention programs. For more details about these analyses, please see our recently published paper in PLOS One. We'd like to thank the people living in the WITS MRC Agincourt Unit Study area and the study team members. Thanks very much.